Good morning, thank you, or good afternoon for folks on the East Coast. I know that there are many exciting things happening in the world today, and let's be frank, this is probably the most exciting, so welcome. And I'm glad that you're all able to join us. I know that everyone is pretty busy, so thank you for taking the time. Some of this presentation uses California-specific data, so that's just an FYI. But healthy retail is obviously something that a lot of people are interested in across the country. So, just noting that even if you're not from California, I think there's lots to learn. First, some introductions. My name is Ray Leung. I am a senior staff attorney here at ChangeLab Solutions. I know that we have a lot of folks on the webinar who are very familiar with our organization, but there are always new people sort of joining our webinars and getting to know us, which is great. So I'll give a brief spiel about what we do at ChangeLab. We are a nonprofit organization. We're based in Oakland, California, but we do work nationally. And our mission is to make communities healthier through law and policy. And we do that by providing technical assistance. We develop model policies. We develop other written materials like fact sheets and playbooks. And of course, we do trainings, which is why we're here today.
Hi everyone, my name is Sarah Bartel and I'm a staff attorney at ChangeLab Solutions. I work in many different areas of our policy solutions for making healthier communities. I've especially done a lot of work in tobacco control, including in the retail environment, and now I'm taking on a larger role on our healthy food retail portfolio with Rio Holiday, who I'm filling in for today. So I'm excited to be bringing the overlaps in my own work to today's webinar. And with that, I'll hand it over to Sabrina.
Thanks, Sarah. And I'm Sabrina Adler. I am also an attorney here, and I work on a variety of different things across our portfolio. But on today's webinar, I'm going to mostly be the voice of alcohol, so to speak.
Great. Now you've all met the team. Here is a brief disclaimer, and there's a lot of text here, but it pretty much just says that we're not giving legal advice, even though we're attorneys. All right, so here are today's learning objectives. Apparently one of them is a reminder about eating bananas, so there's that. But aside from that, I pretty much just want to give you a sense of why you're on today's webinar. So first I'm going to highlight some data from Healthy Stores for a Healthy Community. And I'll explain what that is in a bit for those who aren't familiar, since there might be folks that might not be familiar, even if you're in California, and there might be folks outside of California. So hopefully you'll be able to identify some data that would be helpful in your healthy retail work in California. But not only that, hopefully you'll just get a sense of how to tell a story with that data. And like I said before, if you're not from California, I think there's still lots to learn about the Healthy Stores for a Healthy Community campaign in general. So look for tips there. Second, you'll be able to list the 5 healthy retail policy categories and identify examples within each. And third, you'll know about the key resources that are available to you if you're interested in healthy retail. Sarah's going to start off with an icebreaker so everyone gets a sense of who's on the webinar and what we've all done, because I think there's probably a lot of variance here. I will talk about the Healthy Stores for a Healthy Community data and some takeaways. And then Sarah's going to next talk about definitions, as in what is healthy retail, what does healthy retail mean to you? It's a very philosophical question that Sarah's going to help us with. And then the bulk of our time is going to be spent on going over different categories of policies and examples and resources. So hopefully that's all going to be really helpful to you. And this is something that Sarah, Sabrina, and I will chime in on together. So we'll sort of tag team on and off. Last but not least, we'll take questions and hopefully answer them. All right, some initial housekeeping. So you can ask questions in the chat box to your lower left-hand side. And the second thing is I just highly recommend that you turn down the distractions in your office or wherever you're sitting. If there are any particular government hearings, for example, that you're interested in reading about, I highly recommend that you read about them after.
Thanks, Ray. So I believe that webinars should be as engaging and as fun as possible. So I was sort of voluntold today to run a quick icebreaker for everyone. So in order to make this engaging, I have a series of polls that I'll ask you to answer with the goal of figuring out who's on the call and what we're thinking about and working on. And in order to make this fun, I have a series of banana-related jokes to entertain you while you answer the questions. So get ready. First up, since we're talking about multiple issue areas today, I'm interested to see what people are working on. Do you work on tobacco, food, alcohol, or other? You can choose more than one option here, I think. So as the results come in, here's the first of our banana jokes. Why do bananas wear suntan lotion? Because they peel. So good. No other jokes. It looks like we've got a lot of responses coming in. And most people are working on tobacco. We've got another large contingency of people working on food, some people working on alcohol. And it looks like some other areas that are coming in on the comment box include opioids, STDs and HIV and condom access, and marijuana, physical activity, breastfeeding. So it looks like we've got a bunch of different areas, and also some laughter, which I very much appreciate. Not that I deserve it. So our next question is, because we work a lot in California, especially on our tobacco issues, we're just curious about whether you work in California or not. And so our next joke is, why did the banana go out with the prune? Because he couldn't find a date. So it looks like we're half and half right now. The responses are still rolling in, but it looks like about half of people are working in California and half of you are working elsewhere. And if you have any states that you work on specifically, if you're not just national, go ahead and put those responses into the chat box as well. We'd love to know what other states are represented. And it's still like neck and neck, half and half of respondents. Oklahoma, Pennsylvania, Ohio, North Carolina, Florida. You guys are awesome. Texas, Wisconsin, Alaska, all over the place. Hawaii. This is great. So we're going to go to the next poll here. Have you ever collaborated with tobacco, food, alcohol, or other partners on work in the retail environment? So if you work primarily in tobacco, tell us if you've collaborated with food, alcohol, or other partners, and vice versa. And if your answer is yes on this one, please do describe the collaboration in the chat box. So since this question is going to take a little longer to answer, I have two banana jokes for you. So the first one is, what do you call two banana skins? A pair of slippers. And finally, my favorite, I am going bananas. That's what I say to my bananas before I leave the house. Okay, it looks like most of you have worked with other partners in the retail environment. We've got 67 responses of people who have. A lot of people working through the HSHC campaign, through HR objectives. They're thinking about PSC and other initiatives, using CounterTools software, which is a great tobacco control organization, fruits and veggie fests, and other healthy corner store initiatives with nonprofits, which is awesome. Tobacco youth purchase surveys that have worked with both alcohol and nutrition partners. So it's really exciting to hear that you guys are all over this. The next poll is actually just for Ray, who wrangled this webinar together. How satisfied were you with my banana jokes, and will you invite me back to another webinar? Your options are heck yeah, nah, and definitely not. Please stick to your talking points for the rest of the webinar. Ray, we can talk about that one offline.
This might encourage bad behavior, just so people know. Great. Well, thank you, Sarah, for those jokes. Lovely. So this is kind of the first of a series of questions. But before, I know some of you are sort of responding already, and that's really great. But I'll sort of set up the Healthy Stores for a Healthy Community campaign, since I know that not everyone is from California, and so I just want to give that sort of backdrop before I start. And you'll mention, like Sarah mentioned, HSHC. That just stands for Healthy Stores for a Healthy Community. So here's some context. The Healthy Stores for a Healthy Community campaign is a California statewide collaboration between tobacco and alcohol use prevention, sexually transmitted disease prevention, and nutrition partners. The goal is to improve the health of Californians through changes in community stores and really to educate people on how in-store product marketing influences the consumption of healthy products. And as part of this campaign, data was first collected in 2013, so that's when it started, and then more recently in 2016. And so earlier this year, the data was released and it's public, and there's a website for it, which I'll mention in a little bit. In terms of methodology, if you're not familiar with it, the data collection happened in each county in California. For each county, zip codes were selected at random, and within selected zip codes, all eligible stores were surveyed. So now what's an eligible store? So that's a good question. An eligible store has to meet several criteria. One, it has to sell tobacco. Two, it must have been accessible to minors, so like a supermarket or a 7-Eleven. And three, it had to have been a store that doesn't have a membership or fee requirement, so nothing like a Costco. You can go to Healthy Stores, healthycommunity.com, and the data is available there. So that's Healthy Stores, healthycommunity.com. And it's broken down, the data is broken down by county, so that's going to be helpful for the local work that you're doing. So this question, which all of you have sort of answered already, what percentage of tobacco retail stores have unhealthy products sold at checkout? It looks like most of you sort of said 90%, and then sort of the next biggest chunk was 75%. So I'm going to move on to the results. And so that's the results. And the answer, some of you are still answering, but the answer is 90% of tobacco retail stores have unhealthy products sold at checkout. And I have to say, this poor guy, I don't know what he thought when he smiles for this photo, but we've been using him a lot to highlight the unhealthy stuff that he's selling. This type of information, I just want to note that, when you say 90%, this can really resonate with policymakers, not to mention the general public when you're talking about the problem of unhealthy foods in our neighborhoods, and not just unhealthy foods, but unhealthy things that are being sold. So as you're thinking about the different data that you're getting, and it could be through Healthy Stores, Healthy Community, or whatever local data that you have in your community, there's a lot of good data out there. Think about what's going to work in your community, and it really is going to be different depending on where you're working. All right, second question. What percentage of surveyed stores had healthy storefront ads like for milk or veggies? Great. So again, a big chunk of you are saying sort of the right answer, which is less than 15%. A lot of you are saying that. And then the next biggest chunk, you're sort of guessing 33%. So there are the results of what people are saying. And the answer is less than 15%, so A. This is another piece of data that I think is really critical, because when you put this side by side with the first question, which 90% of checkouts have unhealthy products, I think it's just a really important contrast. It tells a story about our neighborhoods, about what kind of what's happening with the healthy foods that should be sold in our neighborhoods versus the unhealthy foods and products that are sold in our neighborhoods. So again, thinking more broadly about the context and what story that you want to tell for policymakers as well as the general public. All right, third question. Stores in California communities with the highest percentage of low-income individuals sold their cheapest flavored Swisher Sweets for a lower price. And I should say, so low-income individuals are, that's sort of 185 or below 185% of the federal poverty level, in case you have a question about that. And if you don't know what Swisher Sweets are, it's a brand of cigars. They're mostly flavored, and they mostly come in packages that cost less than $1. So in case you don't have that context. Whoa. So here are the results. Almost all of you think that it's true. And the answer, wow, 95% of you guys think it's true. So the answer is true. Compared to all California communities, stores in communities with the highest percentage of low-income individuals sold their cheapest flavored Swisher Sweets for a lower price. It's actually, so the data from Healthy Stores, Healthy Community, from that campaign, it shows it's 97 cents for one flavored Swisher Sweet for the general population, and it's actually 7 cents cheaper in communities with the highest percentage of low-income individuals. It's 90 cents for those communities. And this is really important. I mean, unfortunately, I don't think that this is a surprise, and I think that's evidenced by, over 90% of you saying true to this question. But I do think that it's helpful to be able to point at this data to highlight the problem. So one of the things that I recommend when you're thinking about what story to tell is to really focus on the disparities. That's just really critical. That should be top of mind when you're thinking about what policies to advocate for to target priority populations. And it should also be in your messaging as well, because I think that's going to really resonate with some policymakers and the public. Okay, next question. Most stores surveyed sold condoms on shelves that are unlocked. True or false? Okay, so we're getting a lot of responses. This is actually really interesting. So we're getting, let's take a look at the results. So pretty even actually, 50-50. Just wait for a few more people to sort of chime in here. Then the answer is false. Only about 1 in 3 stores had condoms on an unlocked shelf. Though over 80% of stores do carry condoms, so I think that's great. They carry condoms, but a lot of them are actually on shelves that are locked. For those outside of California, I just wanted to sort of bring this question to the forefront because I think that it's a perfect example of how Healthy Stores, Healthy Community really is a cutting-edge campaign that incorporates a lot of different aspects that are part of the healthy retail environment. It's not just about tobacco, it's not just about food, and it's not even just about alcohol. It's thinking sort of when we're thinking about the healthy retail environment, we should think strategically about what that means. Okay, another question. Fewer stores, another true or false question, fewer stores are putting sodas and sugary drinks at the checkout compared to 3 years ago. Skip to the results. Most of you guys think it's true. It's almost an even split. I'll let some more folks weigh in. And the answer is actually true. In 2016, 41% of stores had sugary drinks at the checkout. And this is actually down from almost 60%. It was sort of 56.9% 3 years ago from the 2013 data. And this is the last question that I have, but I include this because it's a little bit different than the other pieces of data that we're seeing from the campaign. And this is actually kind of good news. I will say, though, that I don't know what the reason is for the decline. But for me, what's striking to me when I look at this data is when we talk about healthy retail, there's always this question of do retailers want this? Are they committed to healthy environments? And I feel that in public health work that affects the retail environment, we constantly have to sort of quote unquote make the business case for something, whether it relates to low sodium products or tobacco prevention, what have you. And here we have data that show that, well, maybe businesses are doing it on their own. So I think that this is something that you can point to. Again, I should caution that I don't actually know why the numbers have declined, but I think that the data can still be used to point out that, hey, this is something that retailers could already be interested in. So when you're getting pushback or questions about whether commerce is interested in this issue, whether retailers are interested in this issue, we have some data that might suggest that they are. The first takeaway, and I think you all know this, but it's always good to have a reminder, you have to tell a story with the data that you're working with. These two data points are a good side-by-side comparison. We also saw something about disparities in one of the questions, and there was some good news too. And really, you should just figure out a way to use all of that. Takeaway number 2, visit healthystores.healthycommunity.com. There are a ton of resources there, including data that are local to your community if you're in California. And for people outside of California, it's really a great opportunity to learn about the campaign and get ideas for your own state or community. And again, that's healthystores.healthycommunity.com. And this takeaway is specific to California, takeaway number 3. If you're a local health department, you have available resources on Partners online in terms of what to do with your local data. So if you need to analyze additional resource or analyze sort of additional statistics, if you need help with that, these resources are available to you. And there's also TCEC, the Tobacco Control Evaluation Center. You can get technical assistance on how to further analyze your data.
So Ray just told us about a lot of unhealthy retail environments, and I'd like to take a moment to think collectively about what a healthy retail environment is. So take a look at the image below. It's an image of a healthy retail environment. What makes it healthy? What's missing? There isn't one definition after all. Go ahead and type your answers into the chat box. And for entertainment, I think this is probably the last joke I have. I will now tell a joke that breaks down silos. A mushroom walks into a bar, and the bartender says, "Hey, you can't drink in here." And the mushroom says, "Why not? I'm a fun guy." So I couldn't find a joke that incorporated tobacco, food, and alcohol, but at least this one combines food and alcohol. So I'm not seeing people putting in their responses about what makes this visual here healthy, but we can highlight a few things. So here on the far right-hand side of the slide, we've got people thinking about where these retailers are located in the community in relation to parks and green spaces, probably in relation to schools. We can't see that closely. You can see there's a lot of healthy things sold. We've got water and salads and advertising for that. You can also see there's healthy foods and signage right next to checkout, which is great so that everybody sees it. So we came up with a definition of a healthy retail environment in partnership with the CDC, which I'll just go ahead and read. A healthy retail environment is one where it is easier to make healthy choices than unhealthy ones. It encourages the purchase and consumption of fruits, vegetables, water, and other nutritious products, and places reasonable controls on tobacco products, non-nutritious foods and beverages, and alcohol. What's important here is that we're talking about multiple products, tobacco, alcohol, healthy food, and unhealthy food. We're not just talking about the inside of the store, but the outside too. We thought it was important to expand the definition this way for a couple reasons. Tobacco use, poor nutrition, lack of physical activity, and excessive alcohol use are the leading causes of preventable death in the United States. Of those 4, tobacco products, non-nutritious foods and beverages, and alcohol are widely available and promoted in the retail environment. In some places, it's easier to find tobacco products and alcohol in stores than it is to find nutritious foods and beverages, as Ray discussed. We know this from the Healthy Stores for a Healthy Community campaign data. And other research tells us that it's more common to find stores selling tobacco products, non-nutritious foods and beverages, and alcohol in low-income communities and communities of color. This isn't just about what's sold inside the store, but many stores, like how many stores there are in the community, for example. There are more tobacco stores than food stores in these communities. So if we're talking about healthy retail, especially in the context of public health, we should really be talking about tobacco, alcohol, and food. And we should be talking about the store and the community too. There's one more thing I want to point out as we're talking about definitions. We've organized our thinking into 5 Ps, expanding on the 4 Ps. You know, real groundbreaking work here. We think that within the store that the products sold the placement of those products, and promotions are important. And we think that in the community more broadly, the price of these items and the prevalence of the stores that sell them are all important. So another poll to keep you engaged and to give us information about what folks are interested in. So which of these 5 Ps are you most interested in working on? This should be pretty quick, so I will spare you a joke. Go ahead and fill those out. It looks like right now the majority of people are working on or interested in working on, oh my gosh, really across the board it's looking even. I can't even keep track. Everybody's pretty evenly interested in all of these areas, which is great because we are now going to provide, let me see if I can get results up there. There we go. We're now going to provide a menu of healthy retail policy options so that you can pick and choose which of the 5 Ps you want to focus on, or which combination, or all 5. So ChangeLab has produced a lot of resources that address the healthy retail environment more broadly, and we also have specific policy resources for each of the 5 Ps that we'll go through. So you'll see these resource slides throughout, and they are organized by policy, and you can have them later. We're going to be sharing these slides, so I'm not going to go into much detail on the resources. They're available on our website and on the websites of the organizations who created them. But just so you know, these are here for you and will be a part of the slides when they're sent out. And with that, we'll launch into the menu. So if you want to increase healthy products available in a store, you can incentivize stores to stock nutritious foods and beverages. The key word here is incentivize. Incentives motivate retailers to make healthy changes on their own. There can also be incentive-based policies, and I'm going to tell you about a permitting incentive which reduces the financial burden of obtaining business permits. So the Mid-Ohio Valley in West Virginia uses a permitting incentive to encourage store owners to stock produce. In order to sell groceries, store owners need a grocery permit, and the health department offers a discount on the grocery permit fee if store owners stock healthy food. For every variety of fresh produce that a store offers, the permit fee is reduced by 20%. So if an owner offers 5 varieties of fresh produce, then the permit fee is waived entirely. If you're interested in other incentives, we've got these resources here. And again, you can find those later. So the next step up from incentivizing stores to stock healthy food is to require them to do so. Unlike an incentive-based permit where retailers can opt in, a policy that requires healthy food to be stocked affects all retailers and therefore has a broader reach. And the mechanism used for this policy is licensing. Nearly all business owners are required to have a county or a city license of some type. In some cases, businesses have to meet certain health standards to get a license. For example, restaurants might be required to meet food safety standards to receive a license, depending on the place. This policy is very prevalent and successful in the tobacco world, where tobacco retailer licensing has been used to restrict the sale and promotion of certain tobacco products. In this vein, a policy could require food retailers to sell a baseline of healthy foods in order to get a license. In 2008, Minneapolis became the first and only, as far as we know right now, locality to adopt what they call a staple foods ordinance. It originally required stores with a grocery license to carry food in 4 staple food groups: vegetables and fruits, meat, poultry, fish or vegetable proteins, bread or cereal, and dairy products and dairy substitutes. The ordinance was updated, though, in 2014 to require 6 additional categories of staple foods, as well as to specify minimum varieties and the amounts of required foods. And the updated list that they used was based on WIC requirements and feedback from store owners about culturally appropriate foods. Here's another resource if you're interested in working on product requirements through licensing.
Great. So in the tobacco context, a good example is a policy prohibiting stores from selling menthol cigarettes and other flavored tobacco products. This is an important way to address health disparities, given that menthol is used to target African Americans in particular, and of course African Americans have a disproportionately high rate of smoking. And I should clarify that the policy that I'm talking about is one that restricts the sale of menthol cigarettes and other flavored tobacco products. So it restricts the sale. It does not penalize people who use these products. So I think that's just a good distinction to know, because I know that that's a question that often comes up. So really the restriction is on the retailers and not on any of the users of menthol cigarettes or other flavored tobacco products. Some good examples are Santa Clara County and Yolo County. And of course, the city of San Francisco is considering its own sales restriction, on menthol cigarettes and flavored tobacco. And some of you may already be aware of that, but that's sort of pending at the moment. This is our model on restricting sales of flavored tobacco products. So the image that you see is kind of a screenshot of what we have currently on our website. We're in the process of updating and revising this current version, which is dated from 2015. And so our new version is going to come out very soon, probably in the next few weeks. So I just want to highlight that for you folks.
Thanks, Ray. So let's move to the next P, which is placement. And one policy idea here is to require stores to create a healthy checkout area. So as anyone who's ever been inside any store knows, and that probably includes all of you, many retailers put unhealthy things near the checkout area. So that could be tobacco, could be sugary drinks, candy, alcohol, etc. And as a result, while you're waiting in line near the checkout, you're prompted to reach out for those things and put them in your basket. And there's actually scientific and behavioral data that shows that that's true and really difficult to resist. And as someone that works on this sort of policy, I still fall victim to that. So we know that that happens. So one solution is to actually just replace those unhealthy products with healthy ones, so that when you're prompted to grab something when standing in line in that one place in the store that you can't avoid, what you're grabbing is something healthy. There are a lot of communities that have implemented healthy checkout programs, sometimes as part of a broader intervention that applies to the entire store. So one example is in Toledo, Ohio, where the health department worked with the store owner to move produce from the back of the store to display right by the cash register. And as a result, the store's WIC sales for fruits and vegetables increased by 50%, and there was less produce waste. So you can see on this slide there's a little purple icon or bubble that says emerging policy idea. And you'll have noticed my example that I just gave was about a store owner that did this voluntarily. So we haven't seen, though certainly alert us if you know of this, that there's been a healthy checkout policy, big P policy, so a law of some sort implemented in the country yet. But there definitely have been great results from programs and we've therefore created a model policy for anyone interested in working on this. There's no reason why it couldn't be done as a legal requirement. So here's that model policy I just mentioned on the left, and then there are some other covers here that show resources that both from us and the one on the right from Center for Science and the Public Interest that talk more about healthy checkout.
Great. And in the tobacco context, just sort of to give people a broad overview of kind of like how each category affects different types of work. So a type of placement restriction in the tobacco context, I think the biggest example that probably a lot of you already are familiar with is to prohibit tobacco self-service displays, and that's just making sure that kids don't have access to tobacco products without the help of a cashier or a clerk or someone like that. And in large part, in a lot of states, this is already in a lot of state laws. This is in the California state law. Certainly, there are a lot of local laws that cover this issue already. I will say that in California, though, there are exceptions to this prohibition on self-service displays. So that's why in our in Change Lab Solutions tobacco retailer licensing model ordinance, which I will advance to the next slide so you get a picture of what that looks like. So our TRL model ordinance actually has a provision that is it doesn't have any loopholes or exceptions like what the California state law has. So I think that don't just rely on the California state law. If you're in California and working in a local community, you should really be adopting a strong provision like the one that we have in our tobacco retailer licensing model ordinance. And for communities outside of California, I would just encourage you to know your law, whether that's state law or local law, and just get a sense of what that covers and make sure that it's comprehensive.
Great. So for the next P, promotions, I'd like to talk a little bit about signage. And if you walk by a corner store, it's likely that there are a lot of advertisements on the doors, on the windows, and on the outside. And those are often for unhealthy products like soda, tobacco, or alcohol. So one way to address that issue is by passing a policy that limits the amount of storefront signage on a store. A window sign ordinance, for example, that restricts the amount of signage in windows and transparent doors means that all advertising is limited, including ads for unhealthy products. And according to experts, a best practice is that signs shouldn't cover more than 10% of window space. So one important thing to note, and I'm not going to go into the legal details about this, but if you're curious about it, I can answer questions later, is that window sign policies need to be content neutral. So that means that you can restrict the total amount of signage on windows, but what you can't do is be very specific about the type of signage. That's just part of the way that our legal system and our free speech protections work. So for example, you couldn't have a policy that just is targeting soda ads but no other kinds of ads. So an example here is that in 2012, St. Paul, Minnesota passed a window sign ordinance that doesn't allow temporary signs of any kind to cover more than 30% of commercial storefront windows. And the goal of the ordinance is to improve the visibility of the cashier area and promote public safety. Similarly, you might know that in the state of California, there's a law that prohibits stores that sell alcohol for consumption off the premises, so liquor stores as an example, from covering more than 33% of their windows with signage. And it requires all the signage that is there to be placed in a way that law enforcement officers will have a clear and unobstructed view of the inside of the store, including that cash register area. So we do have a model policy on this. It's on our website. You can see here this one is California specific, but it certainly could be adapted for use in other places. So another emerging policy idea is that purple bubble is there here. So it means that we haven't seen it implemented yet, but based on sound science and successful policies in other contexts is this idea of warning labels. As you know, federal law requires health warnings already on tobacco and alcohol products. And the tobacco warning label says, for example, Surgeon General's warning, smoking causes lung cancer, heart disease, emphysema, and may complicate pregnancy. If you've looked at a bottle of wine or some other kind of alcohol, you will have seen the warning that says, according to the Surgeon General, women shouldn't drink alcohol during pregnancy because of the risk of birth defects, and consumption of alcohol impairs your ability to drive a car and may cause health problems. These are paraphrased. It's probably not quoting exactly from those warnings. But research does show that warning labels can increase knowledge of health risks and reduce consumption and use of tobacco products and alcohol. So one way to apply this to the food landscape is a policy that requires safety warnings about sugary drinks to be placed one on the can, but more relevant or the product container, but more relevant to this conversation on shelves or in other parts of stores that sell sugary drinks. That warning would tell consumers about the potentially unhealthy effects of those drinks and would also complement other nutrition education programs and policies by providing consumers with information to make healthy choices. So I will note for those of you who are paying attention to this particular issue that San Francisco did enact a law that's a variation on this, and that requires warnings on sugary drink ads like billboards that are located within the city. They're currently in a legal battle over this approach, which hasn't yet been resolved, so it's a bit of a stay tuned. But I think that court case will be instructive when it comes to this policy approach. As far as resources go, we also have a model policy on this, which you can see up here on this slide.
Great, and I'm going to sort of go into pricing here. And as you can see on the slide, this says require tobacco minimum prices, require minimum pack size, require proportional pricing, and prohibit discounts and coupons. And so I think just the backdrop is that we have a lot of data that shows that pricing is really important. We have a lot of data from just the tobacco control context if you're looking at that. And we know that with a lot of, well, with tax increases, what you get is you get decreased consumption. You raise the price and fewer people smoke, and you know that's a great thing. So here's an example of a jurisdiction in California, Sonoma County, and for those of you outside of California, there's a sort of wine country, for those of you not familiar. They adopted a local ordinance that requires a minimum price of $7 per pack of cigarettes, and this is effective January 1st of 2018. So it's not yet effective, but it will be at the start of the new year. And Sonoma County, they're not the only ones out there. It was actually New York City a few years ago. They adopted their minimum price per pack, and initially they adopted $10.50. And New York City also adopted, their ordinance included a restriction on the redemption of tobacco discounts and coupons. So we're thinking about, you know, buy one get one free, multiple pack offers, whatever coupons that are stuck on the package of cigarettes and that retailers sort of peel off and scan in their barcode to get $1 off or $2 off. And so these are examples of the types of policies, at least with respect to tobacco, that you could implement at the local level to sort of make sure that the industry is not able to sort of price discriminate and sort of target lower income communities with a lower price and certain people, certain priority populations with lower prices. This is ChangeLab Solutions plugin policy options regulating price. This is specific to tobacco, and yeah, so this document sort of gives the different options. There's a restriction on the redemption of tobacco coupons and discounts. There's setting a minimum price of whatever price you think is appropriate for your jurisdiction, and then also there's a minimum package size for cigars and other tobacco products. And so one of the things that I mentioned in the data before was these Swisher Sweets, which again are flavored, they're oftentimes flavored cigars, and they oftentimes come in packages that cost $1 or less. Usually it's less than $1. And so the idea of minimum packaging is just to require that packaging you know, sort of come in packages of, or cigarettes come in, not cigarettes, excuse me, cigars come in packages of maybe 10 or 20, something that would sort of force retailers to increase the price. But this minimum package policy idea is kind of trying to get at the problem without tackling price directly. So what I would say is it's a policy option, but probably the most direct way of influencing price is setting a minimum price floor and also prohibiting the redemption of tobacco discounts and coupons.
Thanks, Ray. Another policy option for pricing is to increase taxes on unhealthy items and to decrease taxes on healthy items. This one's pretty straightforward, and it's been used in the alcohol and tobacco worlds for a long time. And a food example of this policy is that in 2014, the Navajo Nation passed a law that placed a 2% tax on food with little to no nutritional value. So that included snacks and sugary beverages. And all of the tax revenue goes toward the Community Wellness Development Fund. And the Navajo Nation also revised the Navajo Nation sales tax to remove a 5% tax on nutritious items, including fresh fruits and vegetables, water, nuts, seeds, and nut butters.
So just a quick note jumping in to say that the mechanism for doing this, meaning whether a tax would have to be passed by voters or whether the city council or other elected body can do that without voter approval, really depends on the state. So here in California, there are requirements for voter approval. In some other places, like Seattle, just the other day, the city council has been able to do this on their own. And whether it's an option in localities also depends on the state. So in some states, local taxes on sugary drinks or even on alcohol are allowed, and in other places, that's not the case. So the short version here is you definitely want to consult with a lawyer and with other people working on this policy. And here are some resources on taxes in the tobacco, alcohol, and sugary drink context, some of which are our own and some of which come from other organizations, agencies, including the CDC.
For the final P that we added to the 4 Ps here, prevalence, an emerging policy idea is to restrict the location of retailers that sell unhealthy foods and beverages. For example, your community may want to prohibit retailers from selling unhealthy food if they are close to schools or parks or child care centers, libraries, or other child-oriented places. And this emerging policy is based on the public health policies that restrict the location of tobacco and alcohol retailers, as well as policies that require fast food restaurants or mobile food vendors from locating or requiring them to be located a specified minimum distance from these youth-oriented areas or from churches or parks or other community areas. In California, multiple localities will not give tobacco retailer licenses to stores that are located near schools, daycare centers, or other youth-oriented places. And another example of this is from the city of San Francisco, where there's also a cap on the number of tobacco retailer permits that can be issued within each district, which means that if a neighborhood has at or above the cap number of retailers, some tobacco stores must stop selling tobacco products or close before new ones can be permitted.
So as Sarah noted, this is an approach that can and is frequently used in the alcohol context as well. Depending on the state, localities can either use licensing or zoning or both to restrict where alcohol outlets are located and also to control how many of them there are. So in some places, a new law can apply to both existing and future outlets that aren't yet open. In other places, this tactic is really only a viable option for outlets that haven't yet opened, so future outlets. Additionally, in some places, there are other conditions that can be attached to the laws that restrict location. So for example, there might be conditions placed on a permit that regulate opening hours or lighting or litter. The exact options for all of these things depend on state law. So this is another place where you'll want to consult with someone who's familiar with the context within your state, but it's a common tool that's used in the alcohol realm.
And this is a tobacco retailer density infographic that actually Sarah worked on much of this year and last year. And so this we published earlier this year, and I just want to highlight it as different policy options that you can use for yourself, for policymakers, for the general public to think about how to reduce the density. And again, I'm going to move through this really quickly, but you're going to have slides later, so you can take a look at that after the webinar is over.
Here too you can see our Model Healthy Food Zone ordinance. Again, resources are going to be available later. Because now I want to talk about collaboration. Collaborating on healthy retail is crucial to creating policies that will have lasting effects across all of these product areas. And tobacco control advocates, healthy food advocates, and advocates working on excessive alcohol consumption prevention policies all have unique perspectives and skills that can contribute to developing strong, comprehensive policies and solutions that get more policy support by the fact that there includes collaboration. And of course, there's not one model of what collaboration will look like across different communities. So I know we're close to time here, and I want to leave time for questions, but I'm just going to spin through a few examples and then give you a resource where you can find all of these examples and links and resources on them. So the first collaboration model is to create a task force or working group. LA County and Sonoma County both have versions of this working group and have done really interesting work around thinking about healthy retail certification on all 3 areas, and also just doing an assessment of a catalog of all the different retail projects in these issue areas to see how much overlap there already is. Another model for collaboration is to present a unified front on related issues, to promote each other's work, to present together. So our example here is California's statewide healthy retail working group that presented at the annual California Conference of Local Directors of Health Education. So making sure that they've got a public voice that is out there and people can hear and get information about. The next collaboration model is to write these collaborative activities into work plans so that collaborative efforts are recognized components of strong project development. And Ohio changed the request for proposal for its Creating Healthy Communities grant program so that for the first time local health department applicants had the option to work on discouraging tobacco sales in small stores in addition to their work on nutrition interventions in the retail environment more broadly. Next up is support, funding, right? Fund collaborative activities. So in Vermont, the state tobacco control, nutrition, and excessive alcohol use prevention programs worked all together to fund healthy retail efforts in their communities. So anybody receiving funding from one of these programs was also required to work on healthy retail activities. And those retail activities were funded by the nutrition program. Next up for collaboration is working together to design a healthy retail program. So Massachusetts Healthy Retail Task Force got together and developed their own healthy retail ranking sheet, a tool that sets the standards for tobacco, nutrition, and alcohol-related standards all in one place. And finally, we always encourage people to share resources. And this doesn't just mean sharing funding sources or sharing information, but it can actually be sharing staff. So Pennsylvania's Healthy Corner Store initiative was really limited because the Division of Nutrition and Physical Activity, due to the way that the state's public health infrastructure worked, they were only reaching about 40% of the state's population. But the Tobacco Prevention and Control division had regional primary contractors that were reaching all across the state and had strong relationships with local coalitions and a familiarity already with the retail environment. And they were able to cross-train those regional consultants so that now they were working on tobacco and nutrition issues. And again, I know I spun through them really quickly, but all of those resources and examples are available in our Healthy Retail Collaboration Workbook, which is available on our website and I mentioned earlier. And with that, I will hand it back to Ray for questions.
Great, thanks. And I'm just going to skip ahead a slide and just highlight the resources that we have, and then I'll go back to questions. But we have a ton of resources on our website, and most recently we published with CDC funding and with cooperating with the CDC a number of publications last year in the summer of 2016. And so I just want to highlight some of these. There's a Healthy Retail Playbook. There's a workbook, that collaboration workbook that you see second from the left. There are just a number of these publications that I think can be really useful to you as you're thinking through healthy retail. And so I encourage you to go to our website. You can also Google it if you can't find it on our website, ChangeLab Healthy Retail, and you'll probably go right to the web page. So now I'm going to throw it out to questions. If people have any questions, they've been coming in, but please feel free to ask them in the chat box. One question that someone had, and I'll throw it out to Sabrina to see if she can answer this. So one question that came out was, how do you define reasonable controls when we say that? What does that mean, and what does that mean for regulation?
Thank you, Ray. I mean, there's a lot of ways to answer that question. I don't think there's a definitive answer, and Ray, you can feel free to disagree with me on this. But I think when we're talking about reasonable, there's a political component for sure, and what's actually feasible and could happen within the community where you're located. I think you're also wanting to take into account that these are businesses that you're regulating, and in some cases they're small businesses. And in some cases, small businesses in low-income communities where the owners of the businesses themselves may be part of lower-income minority communities. So I think that taking all of those pieces into account, reasonable, it's a relative term, but reasonable probably means thinking about whether you're going to drive someone out of business and whether that's better or worse than having some of the problems that you might be seeing in the store, for example. thinking about what the penalties are for when you're implementing or enacting certain restrictions, and thinking about some of the unintended consequences, and also the overall effect on access to products, including healthy products. I don't know if you want to add anything to that, Ray.
Oh, I don't really have much to add. I mean, I think that's a good point. It's all relative. So, places that are urban are going to be different from places that are rural. And if San Francisco does something, people usually roll their eyes and think that's San Francisco. So I think that really it kind of depends on where you are. And this kind of links with another question that someone else asked, which is, how does a local advocate choose to pair these policies, kind of like the different policy examples in the different 5 Ps when you're approaching when you're thinking about different policy approaches in different cities and counties, like how do you pick? And I think that a large part of it is like politically, what is the political will there? Is there political capital? But also, I should mention that a lot of it has to do with community engagement and community outreach, and that's a really critical component. You should, as an advocate, you should kind of know what the community wants, and that's going to require resources and time to figure that out. But I think that's an important component of it. So there are some questions that can be easily answered, so I'll try to answer these fairly quickly. There's a question about who restricted coupons and discounts, what county. So New York City and Providence, Rhode Island are jurisdictions that have restricted / prohibited the redemption of tobacco coupons and discounts. I did talk earlier about minimum prices as well, so that's separate from a restriction on coupons and discounts. The minimum price regulations that I know of are in New York City, and that was adopted a few years ago. And then there's also a minimum price law that sets the minimum price for $7 in Sonoma County. So it's Sonoma County in California that has the minimum price, but Sonoma County did not adopt a restriction on coupons and discounts. And there's another question about the $2 tax increase. So there's a question about whether the cigars, the Swisher Sweets sold in 1 to 2 packs are subject to the $2 tax increase in California. So this is a California-specific question. And the answer is yes, those are tobacco products that are subject to the new tax. Let's see. There's a question about someone asked, how were you able to pass the menthol flavor ban? Was there a lot of backlash, or were people supportive? I think that's a really great question, and while we provide legal technical assistance to a number of communities, we don't sort of do the advocacy piece, but I'll sort of mention that it was Santa Clara County in California and Yolo County that did the recent menthol bans, and of course San Francisco is considering one. There's a pending legislation before the Board of Supervisors. So those are the jurisdictions. I encourage you to reach out to folks there if you're interested in learning about what that experience was like. And if you don't have contacts there, then please send me an email, send anybody on this webinar an email, and we will connect you to the right people so that you can ask those questions. Those are really good questions to have. There's a question about what are ways that healthy retail programs can be evaluated. That's a good question. I think evaluation is really important, although I'm not sure what to say other than that it should be a component of all the different policies that you're adopting, just to make sure that you understand what the sort of health impacts are and the economic impacts. I don't know, Sabrina, do you have anything to add to that?
I don't, but I would say if you're specifically interested in that, and this is true of anything else that we were talking about or don't have time to get to, that you should follow up with us. And actually maybe I'll put our contact info up, our website and our email addresses. We are not the only 3 people that work here, surprisingly, and there are others that have different specific niche areas of expertise that can answer questions in more detail that we might not have time to address or have gotten to today.
Yeah, and it's 12:01 on Pacific time, California time, and for Eastern it's now, well, same. It's past the hour, and I want to be respectful of people's time, so I will sort of cut it off here and end it. What I will say is that we really appreciate the feedback from participants. So if you could take the time either now or later on in the day to respond to the survey that you're going to get as a participant, that would be really greatly appreciated. We value your feedback. And there are some questions that we didn't get to. So if we didn't get to your question, please email us. Our emails are on the screen in front of you. So any one of us can get you an answer to the question. So with that, thank you for participating, and enjoy the rest of your day.